so sorry. That was shocking. I was like, I'm going to be off that.
This roller derby, I need more. What did you do to these ankles?
Oh, it was headrest. I'm sorry. So my life flashed before my eyes. Like, it's fine. I'm good now. I'm ready.
Our neck belongs where all the segments are interlocked. The ear's over the shoulder. The upper neck is working. When the head goes forward and translates forward, there's a fanning of the lower neck spinuses. Then there's fluid that infiltrates in there because there's like a space that's occupied. Fluid, fat.
I'm so fanned right now, though, and it's freaky looking.
Right.
What?
I know, there's your tattoos.
That's wild. That's
where all that pain was.
Yeah.
That's the left side. It's higher. I didn't take a 3D shot of this, but this is elevated over here. We'll get there. You're doing great.
I didn't even feel that.
I know. I've told you I'm sneaky.
That's crazy. This is how I stand all the time. So the one chiropractor that I had, he would have the clients come in, sit down for like a seminar. Stopped working there was because I was like, I feel like we're taking advantage of these people. Like, I don't know. So, So anyway, and then I went in 2019 because I had a weird stabbing pain, like I couldn't even find it. Everybody's like, point out where it is, and I couldn't find it back here. And it was every day for like 2 years.
Okay. The joints are kept healthy through mobility. So yes, moving a joint is how it lubricates itself, like a bearing or an engine. You know, it needs to be running. Letting an engine just sit and idle isn't really good for it. So we'll go
I do
over
a
that.
lot of idling in general in life. And recently I got a massage and she did something up here and it like made it much better, which is weird because it's way back here. But it's like I couldn't even point it out if you tried. I can feel it when I do that.
But more middle back, around the bra strap, middle back area.
Yeah, a little higher, I feel like. Maybe.
Right above it.
Yeah.
So the bra strap creates a conundrum whereby you're pressing in one section, right, and then what will happen is it'll pop out right above or below like a trampoline. What we have to understand with the brassiere is that we have to participate in keeping that area mobile. The bra is a brace that holds it together. It moves. The movement's what keeps it clean. So it's kind of contra to keeping that area soreness-free, inflammation-free. I think it's more midline or more out a little bit?
It feels like closer to
the spine.
Yeah.
Okay, so it's probably what we call the facet joint between the vertebrae. Will give you a real sharp pain right over it. So it's just a joint. The medical world doesn't really operate on those joints in there. Mm-hmm. It's kind of just something that annoys you to death and pisses me off. But it's pretty simple to clean. No pain ever down your legs. No radiating pain.
No, I used to do roller derby.
Okay.
And I messed up like my sciatica or whatever it's called, and I would have pain then, but not for a very long time because I'm pretty stagnant as a human in general. So I don't really do anything risky.
Roller derby, help me out.
It's where you wear roller skates and beat people up.
Wow. Okay, I did not know this. So you're being.
You've never seen like the movies with like roller derby?
No.
Okay.
I'm a very isolated homeschool kind of kid. So if it was anything physical like football, hockey, anything where you're beating, my dad would have, doesn't exist.
Oh really? Yeah, then you wouldn't have known about that. That is intense.
It's like being an orthodontist kid. You're not allowed to eat hard candy.
Yeah.
You're saying, well, you haven't heard of runts? No, I've never was allowed to eat those.
I never thought about that. That's sad. I don't know if this is relevant.
Tell me.
And also, this might be too much information for our first.
No too information. Tell me.
Date. I had giant.
Yes.
And then I got surgery because of the back pain to get rid of them. And so I look like the Hunchback of Notre Dame. And I have a weird buffalo situation happening.
I understand.
Okay.
When we're dealing with posture, it's similar to orthodontistry. It's a process. It took years to grow the posture.
Mm-hmm.
It takes time to undo it. And the front part of the spine has almost relatively zero feeling compared to the back. This is why we see elderly people all going forward, and why kids slouch, and why I'm at the mall or Disney World and everybody's looking down, because the cartilage in the spine has zero feeling. The bone has very little feeling. The cartilage has no feeling. There's two structures that have feeling, which is the joint. It looks like a handshake. So where those two structures kind of glide over each other, that's called the joint. And then obviously the nerve coming out right in front of the joint, this will give you radiating. That's why I was asking if anything was shooting around, because generally the disc will rupture out, and then you have the joint and the disc sandwiching the nerve in between, and then nerve pressure, that's what causes sciatica or numbness down the arm or tingling. When you bend forward, see how that hole changes in size?
Yeah.
So you can make we call it the intervertebral foramen, but the hole can be made larger by bending forward. And that's
I want the hole bigger.
right. Well, that's going to make you feel better, right? And that's this is the issue though. The more you bend forward, the more that's what makes people feel better. That's what creates the hump, right? Because in avoidance, the disc has no feeling, this is made about 70-80% water. So the more you bend forward, the more this structure dehydrates. Okay, so this is what people take MRIs for, and you can see it somewhat on X-ray, the height loss of the disc. I'm using this because it's easier to see than the lower neck, but the principle is the same.
Yeah.
So the more weight that's on the disc, because this is made of water like a sponge, it thins out. So
That totally makes sense.
so you have a disc and a hole. The more you compress the disc, the more the hole narrows, which then means you need to bend forward more to open up the hole, which compresses the disc more, which means you have to keep going farther forward, compressing the disc more. Right, that's why it's a progression.
Yeah.
That's why, well, Ed, 10 years ago I was here, 5 years ago I was here. You understand? It just keeps growing.
Yeah.
Till you're at our favorite restaurant here, Dutch Heritage here in San
Oh,
Diego. One of those Amish restaurants where, I kid you not, there was a gentleman the other day,
Yeah.
where you're literally in L shape.
I'm like, that's gonna be me.
That's where people go because, again, I'm going back to what I said, the discs have no feeling.
So you don't know you're messing it
You
up.
don't know you're messing it up, like the enamel on your teeth. You might say to a dental hygienist that you grind your teeth or you chew on hard candy, and you say, well, that's not good for you. You're like, well, it doesn't hurt. And they say, well, we don't care. Pain isn't the barometer for spinal health. This is being pushed in here, and then you're inflaming a joint above or below. Pretty easy to fix. We'll get that better. The main thing I'd be concerned about is if this is really tight, your lower back's probably going to compensate and overwork, or your lower neck overworks. And Ed, my head went forward to get away from things, and I feel fine. Right, but you're in avoidance.
Right.
So, ow, you're hurting me. Oh, there we go.
Yeah.
And there are a lot of practitioners that they keep helping people avoid. One exercise I call Williams exercise is you lay on your back and you pull your knee to your chest, or you keep rounding forward, and you're like, oh, that feels better. Thanks, doc.
Yeah, that sounds great.
My orthodontist wasn't my friend for 2 years. I never liked the guy. He tightened the wires, but he straightened my teeth, and he told me that the alignment of my teeth was going to allow them to last longer. Right? I had overbite. They said my bottom teeth were going to get shaved off. He didn't say he believed it. He said that, look, this alignment causes this problem. And the head forward posture causes accelerated aging of the cartilage. Think of it like tread on a tire. There's only so many revolutions, so many rotations. The neck is designed to function at the top first. So our skull sits on this round donut called the atlas. In front of this would be your esophagus, your airway, your larynx here. So it's underneath all of that. But the neck in this model does a really good job of showing how much range of motion is supposed to come from the top bone. So 24 vertebrae in here, but we only gave names to 2 of them. 2 vertebrae got a name, the atlas and axis. We gave names to these top 2 vertebrae because of their high level of importance. If this joint isn't moving, another joint's going to have to do extra. So what we're doing with the adjustment isn't to change posture. We're checking to see how mobile this joint is. If this area is stiff, because we're idle, and we're rounded forward, and our upper neck gets tight, the lower neck ends up doing more rotation and all the bending is occurring at the bottom. That wears out the cartilage, the nerve gets a little pressure, you just go, oh, there we go, all fixed.
Yeah.
And our posture changes as a result, as a way to get pressure off these nerves, pressure off the nerves and pressure off the joint. This is all supposed to actually fold into itself when, almost like a little butt. They're actually all...
It's like a child.
Right? It does. Look at that. That's a butt. That is a butt if I've ever... Anyway, the top, let's say, fold here goes into that, actually connects. When there's a curve in your neck, can you imagine that? They all sort of interlock with each other.
They're supposed to or they're not?
Yes, they're supposed to. So there's supposed to be a curve in your neck.
Okay.
Have you been told that?
I can't remember.
Okay, it's okay. These are like, these are like foundational things that I am depressed a little bit because by the time people leave my office, they're like, Ed, would you stop talking about curves? Because it's all I ever talk about.
Right.
Because it's the only reason I have a job. If you have a curve in your neck, you wouldn't have a hump, right? It was the loss of the curve that caused this to hump out here.
Oh, is this my hump?
Yes.
And this is my neck?
Yes.
Oh, I see it now.
Let me see if I can play here. Play. So see how the hump forms right there when the head goes forward. It's a forward head translation that spaces that out. Do you see?
Yeah, that doesn't look good. Like it's gonna fall off.
Right, I mean, I slowed it down, but this all spaces out. Do you see how when there's a curve in the neck, it's all interlocked? They all,
Oh my goodness.
see how they're all locked together? You can't actually rotate that. You can't overstress the lower neck because all the segments are locked together. You have to fan them out. Let me fast forward. See how they fan?
Mm-hmm.
They all space out. Now that they're fanned out, now we can wear them out. And that's what allows people to wear out their lower neck discs.
Sorry.
It's okay,
It'll
no.
be okay.
Everybody gets fixed.
I'm so fanned right now though, and it's
That's-
freaky looking.
Right. Belongs where all the segments are interlocked. The ears over the shoulder. The upper neck is working. When the head goes forward and translates forward, there's a fanning of the lower neck spinuses. Then there's fluid that infiltrates in there because there's like a space that's occupied. Fluid, fat,
Feel-
goes in there because it's a space. It's like leaving a part of my house empty. It'll get filled with something,
Oh.
right?
Good analogy.
Your body's going to fill that because there's a space, but there shouldn't be a space to begin with. It should be just there's no space for anything because the ear should be over our shoulder. And I'm maybe the first person to tell you that. You know, they call it the external auditory meatus. So look straight forward. I'll catch you. No, relax now.
Like how I normally would
How do
stand?
you watch? Yeah, how you another. So we're about an inch forward. Your shoulder and the shoulders are rounded forward, like you were saying earlier, because of women want to guard their chest. We don't want to.
Yeah, it
So
feels a lot.
We typically, you understand, we round our shoulders forward. So watch this. Watch my. So this. If I pulled my shoulders back, my head would look more forward, right?
Oh,
the
yeah.
shoulders go forward, hiding some of that. So see right there. So if I pulled your shoulders back, does that make sense? The
Yeah.
head forward is actually more like 2 inches if I got your shoulders back where they belong. But because the shoulders have rounded forward, that hides some of that
The
avoidance,
severity of it.
severity of it, right?
Is it fixable?
So just like orthodontistry, it takes time. It's what I do for a living in here, is we do it through a progression, and that's why we brought these models over here. Because the structures in the back have a lot of feeling, I can't just quickly move your head back and ta-da, right? We're gonna, Ed, I have pain in my arm now, right? Because again, your body went forward to get away from something. So we have to clean the spine and then make your whole spine work evenly in order to, that's what this model tries to show. Right, if part of your spine is stiff and I bend the spine, we'll pinch above and below where it's tight, right? They're not moving, right? And that's really all that the adjustment can do is reduce fixations. Chiropractors taught for 100 years that I'm going to change the position of your bone by cracking it, and I'm here to tell you it's not possible. There's ligaments that wrap the spine that determine your posture. So because many times we're idle more forward, the ligaments, the rubber bands on the front are tight. The ones on the back, like fabric, have been stretched out.
Yeah.
So if I pull you upright, this tight ligament here just pulls you back forward. Right, so as much as you're massaged or adjusted or acupunctured or lasered,
Yeah.
you have to get to the front. That's part of what you said earlier. Ed, she released something on the front and made my back feel better.
Yeah.
Right, do you see how
I do now.
It's the front that was tight, and she released some of that tightness, pec tightness, pulling your shoulders forward, that pops out. Right, you see how the shoulder goes forward, and then this pops out back here. This is what's giving you that joint inflammation and pain in your back. So stretching the pec, drawing the shoulder back, exposing your chest, opening up the chest, right? It's part of the daily.
I'm sorry, he just was trying not to make it weird, but it made it weird by
Exposing.
And also I think I've always been so tall that I'm self-conscious, so I've always shrunk myself down to not be
Sure,
so tall.
yeah.
I feel like so extra when I walk with my shoulders back. It's so awkward.
I know. Do it though. It's really back.
I will though.
It's just at the end of the day, we have to participate is the main thing. When you're wearing a brassiere that's stiffening your back, the consequence is that we have to do something to keep that area mobile, because otherwise it's going to lock, and then you're going to overwork the areas right around. So the idea of the adjustment is to get the whole spine full trick. You get the whole spine moving evenly, so you're not pinching above and below.
Question about cleaning it up. So I signed up to come here because one of my followers was like, he's amazing. I'm like, that's so cool, let me message him. And then I researched after we made the appointment, and I saw you doing some Cirque du Soleil moves, and also some rubbing with a torture tool of some
Yes,
kind.
yes.
You say clean the spine.
All right.
Do you mean one of those?
So what I mean by cleaning the spine, I mean that you're removing that tenderness that was caused by your posture. If I rub your back, the marks shouldn't come out. Those marks are there because your alignment's not correct.
So in short answer, yes, this is the tool.
That's the torture tool.
Why do you have it out though? Why is it out today?
I'm nervous.
I'm going to go super gentle. I've never been accused of not talking, and it's far worse than it feels. And we'll go real gentle, and I'll do it, and you might even perceive that that's it. So many times, patients, it looks like I'm...
I feel like I saw a bodybuilder crying on your channel.
Yes. Well, women are the toughest creatures on the planet by far. Men
Smart.
are not, many reasons. Women learn to take care of their bodies at a younger age. They have pain centers in their brain for childbirth that men, so their ability to cope with pain is... But yes, I mean, exactly what you're saying, bodybuilder, so a person that's going to be literally purposefully building up lactic acid. They're doing that as a profession now. And so their tissues are just
That's fair.
filled with soreness.
That makes
and acidity is negatively charged. And if you leave a lot of negative charge around your spine, calcium, which is positively charged, is drawn to the acidity. This is what creates bone spurs. So the bone can grow. If you see on the
Why are some of these beef jerky though?
very good. So that's called desiccation. As you cook, and lactic acid, so I'm trying to say, when you leave acidity along the spine, that ages the spine at a faster rate. The disc has no feeling, and we don't want to age the disc any faster than it needs to age. So what I mean by cleaning, we want to get rid of all that acidity. The acidity is from posture. Many people might teach an idea that your core is weak, and this is a pervasive thing in America right now, that back pain is because your muscles aren't strong enough. It's like a carrot that you'll perpetually chase, in my opinion. Your muscles could always be stronger, right? You could always have more power. And when you felt my back, you don't feel power holding me together. It's the alignment that gives you your stability, not strong muscles that hold you together. But temporarily, if you get in a car accident, muscles get tight to protect. And that's a good thing to guard an injury while it heals. But that's not, it's like a backup function that a muscle can do, not its primary job. It's like, my primary job is to be a chiropractor. Could I deliver pizzas? Yeah. But it's not like, you understand, it's like just because you can do something doesn't mean you should be doing it. There's jobs, not to say anything about pizza drivers, please. Love you guys. That's great.
Yeah, love them. Love pizza so much. Highly recommend. I actually was a pizza delivery person, so I'm not offended. You didn't say anything bad. You just said, could you? Yeah, and you could. I carry my shoulders up here because I'm just like nervous all the time about everything.
Okay.
And so I just, they get sore, but it's probably more musculature. You know the word.
It's okay. It's usually a guarded posture. So this is when we receive an injury. Many times, we go into a guard, and then what happens is your body believes that another injury is going to happen, so I'll just stay here.
Yeah, I don't even realize it sometimes. I was in the shower today, and I'm like, look at those trapezoids, dude. I'm so strong. And then I'm like, that's probably not good. I don't work out. So.
Having your traps engaged all the time, again, a lot of lactic acid. Going back to that cleaning word, you understand? So it's going to be, ow, you're hurting me, Ed. It's sore in there. It's like an engine idle speed. Your engine should be idling at 600, 700 RPMs. It shouldn't be idling at 4,000, running really hard all the time. If you have your shoulders up, the engine's running really quick.
I feel like at some point you all have to make a compilation of all your metaphors and analogies, just back to back to back, because they're good and it could be a nice video. There's so many. I love it. It helps me understand though.
You have two reasons muscles are usually tight. One, your body believes another injury is going to happen. Person gets in a car accident, they go to the hospital, how do you feel? Well, I got tight muscles in my neck and I hurt. Here's muscle relaxants, painkillers, have a nice day, see you in 6 weeks. This happens every day in America. Take a muscle relaxant, you got rid of the God-given protection of the sprained joint that you just received being whiplashed. Take a painkiller so you can't feel it.
Wow.
Right? So the person can only be worse. There's no possibility of that patient improving with muscle relaxants and painkillers after a whiplash. They had a joint injury, a ligament injury, their head went forward to avoid. Now their posture can change, and then they heal in a different posture. I feel better, thanks doc.
Yeah.
And as the result of the accident, their posture just changed, which then accelerates that disc injury.
And they're addicted to drugs now.
Pretty much. No, it's very common. Very common. We have, I don't know, maybe the number's 80,000, what they told us last seminar, opioid overdosings every year in America.
Yeah.
That's known opioid overdosing. So what doesn't get connected, hundreds of thousands of, and so it's pervasive is the idea of ignoring the problem instead of what I'm going to teach you, which is no, we got to confront it.
Yeah.
It's like orthodontistry. It takes time, and we have to create room to move things. Like moving furniture. You can't just move furniture. You got to move where you want to move the piece to before you can put it there.
Yeah.
All of this is filled with fluid, so I can't change anything. I have to first squeeze out some of that fluid to allow your head to come back into it. I was going to say this is the progression. They made a piece of foam that looks like my thumb. It's a retainer.
Oh, yeah.
So I'm going to hold your neck. Remember that curve that we're supposed to have in the neck?
Yeah.
This is a retainer that holds it there. And so at home, at the end of your day, before you go to bed, kind of like brushing your teeth, you remind your spine how to be in the right position.
Okay.
So we would start with a medium neck. We call this a Dena roll.
I bought a posture corrector, one of the Strapides.
They're robbing and paying, is in my opinion, of those things. So you are putting yourself in a better position, but it's a bra. It's stiffening you. So the improved posture at the cost of reduced mobility. I don't know. Is it worth it? Maybe a little bit. I don't know. I don't know how much I like things that are win-win, not win-lose.
Right.
Right. It's like.
Should I hold off then?
We'll talk about it.
Okay.
It's a good thing to, I might be like the neck collar. I have people that have neck injuries and they wonder, should I put a Philadelphia collar on? The collar does two good things. One, it reminds you not to tuck your chin down.
Yeah.
Right? It does stiffen you, but it does remind you to at least not grind your teeth in that sense. And then everybody holds the door open for you. Right? If you're wearing a neck collar, everybody's like,
yeah.
Kids, get away from that person. She's wearing a neck collar.
Yep.
Right? See, I want you healing with mobility. It's not worth healing in the right position if it's all stiff. Right? Because then you're going to pinch things again, and then your head's just going to go right back in the right insert where it comes with a little mini. It's a little baby.
Oh, little guy.
It's like a little Grogu. It's a little baby Yoda.
A little what?
Oh, sorry. You don't watch The Mandalorian, do you? You haven't seen The Mandalorian?
No. Sorry, I will tonight.
Okay. So there's a creature, there's Yoda, right, from Star Wars, and then there's Baby Yoda. It's this cute little, it's hard to imagine Yoda being cute, but...
I think Yoda's cute. He's the ear thing. Yeah, he's cute. Okay, I'd love to see.
Like a Furby.
It's not Yoda?
It's a little baby Yoda.
Oh.
It's a little cute little... My point was that...
It's adorable.
It's a little baby. It's a process, is what I'm trying to say. We don't just go right for the...
Makes sense.
But ultimately, they make another device that goes between your shoulder blades. Does that make sense? And then you would actually arch back.
Why is there a rope on it?
That's the last piece.
Oh. Okay.
Now you punch me and run out the door if I put you on this.
Yeah.
It's way too much pain. I've been adjusted my whole life. This is actually feels like nothing. See, if your spine wants to be curved, and I put it on a curved mold, you don't feel anything because it's where it wants to be, right? If your neck wants to be arched and you put it into a curved mold, and it's easy.
Yeah.
If your neck wants to be straight and you put it on a curved mold, that's difficult. So the amount of disparity between where you want to be and where you need to be, or where we know will last the longest, creates the difficulty in stretching. Again, this is why nobody does it. So today we're gonna just small preview of the stretching.
Love it.
We're just gonna go through your spine, and then based on how mobile it is, tells me how quickly we can move towards stretching.
I'm sure you know that I'm a recovering addict. And so I didn't have an excuse to do it when I started. I was just ignorant. But so many of my friends who I go to recovery meetings and stuff, they're like, I was in a car accident, and now my life is down the drain.
I had a guy the other day, he had, I think, a tooth, maybe, I don't know, maybe a root canal, some tooth procedure, and he said the amount of pills, and he is recovering also, and he's like, I think it'd be 40, put in the blank, the drug they gave him. He's like, this is the beginning of an addiction.
Mm-hmm.
We start chiropractic on the table, get people used to, like teaching how to brush your teeth. I have to watch you brush. Ed, my gums bleed. I hate brushing. Okay, bleeding gums means you're not brushing enough. Right? It's not a reason to not brush.
Right.
Well, I give up now. I hate this toothbrush. No, you got problems. And so as we clean your spine, as we brush it, there's going to be little pockets of inflammation that are trapped in there, and we'll try to gently go through it. And but it's not a reason to, I hate this and I'm going to ignore this. It's, well, we need to work through this, progress through this, talk to me. Ed, you're going too hard. And we start this process of getting your ear over your shoulder, right? And this is where I want to be, not because I'm holding myself here. This is my home posture, and
it's a nice posture.
It's not.
I checked off all the depression, anxiety ones, all the mental health ones.
How much do you sleep at night, just generally?
I'd say 4 to 6.
Okay, and
that's better than what I used to.
What keeps you up? Is it mind going, mind racing? Yeah.
I'm in therapy.
Gotcha.
So it's getting better.
Gotcha.
Slowly but surely.
All right. This is the forward head translation. We call it coupled motion. The head goes forward. This has to pop up, like I showed you in that video. So in order to achieve it, we're going to start pushing that in, and then also retracting the head back, and that's going to reduce that. It took time. It took years to fill that void in there.
Everybody was like, go get liposuction. And I'm like, okay. But then I'm like, wait a minute. There's still going to be a problem in there if I...
It's postural. It's not going to, the pocket's just filled. It's just going to get refilled up. Some of this is lifestyle habits where we'll teach you, try to, on your phone sometimes, on your belly, marching up. We're not spending all day rounding forward, and so, be like, if, my dad would kind of look at us and...
You just stood up without touching the floor. That's impressive.
That was kind of impressive. I was like, pretty good.
Let's get to work.
Can I tell you one quick thing that I'm nervous about? So I'm nervous that I'm going to be tense. So then I'm going to tell myself, just loosen and relax. And I'm afraid that you're going to be preparing for me to be tense, but I'm going to be so relaxed that I am
one of the sneakiest chiropractors. I'm going to massage you a little bit before I even adjust you. Okay. I'm going to give you the most baby adjustment that I've ever given anybody. I have 4 children, 14, 11, 7, and 1.
Oh, I didn't know that.
I'm going to do real baby stuff today. Okay?
I love that baby.
And then if you go, Ed, piece of cake, I'll go a little bit deeper. But again, we're going to start with your middle back. I expect some level of tension in there. It might be a little sore. And like I said, the brassiere is a brace. So when I go in and ask an area to move that hasn't been moving, Ed, that felt great.
Yeah.
It's not. But we have to compress the inflammation in those joints. It's real easy to fix those. Injuries to the disc are permanent. And so your posture means that if you have a fall, you have a car accident, because the discs are sandwiched all the time, the amount of injury that they're going to withstand in an injury is higher than it really even should be. So being in the right alignment, first of all, the forces are going to be more spread out because you're in the right alignment. That makes sense. I had 2 patients. One was a girl that had been adjusted her whole life. The boyfriend had never been adjusted. They were both 19 years old. I had 45-mile-an-hour drunk driver rear ends them at a stoplight, right? The girl had been adjusted her whole life, almost like one I've known since I was a kid. The boyfriend never been adjusted. She felt nothing. She was like, I'm not injured. The boyfriend's dying. He's like, my neck is killing me.
Whoa.
So they both received the same force. Why the large difference in pain? His neck had never been adjusted, so all the force went into one spot in the whiplash. While her neck had been adjusted, she had good posture, the force was more distributed. Right, so how do you value that? How do you put a value on if a trauma happens to you, you're in a better position to withstand it? Take a deep breath in, and then let all the air out real gentle. Let it go. Let it all go. I got you. There we go. Deep breath in. Real easy. I got you. Very good. Exhale. Let it go. All right. Deep breath in. Here we go. Real gentle. Here we go. Exhale. A little tight up there. Yeah. So you get the idea. The area right here, in that buffalo area, in the hump area is tight, right? And that, because this is tight, do you see how your lower neck is going to overwork?
Yes.
It's going to do extra because this area is tight, and so you're going to do all the bending right adjacent to it. That's why the head's going forward. to open up and de-stress the lower neck because your upper back is tight. So people go, how'd you treat her neck? By getting her upper back working. Now the stress is off the lower neck. This is now working because the lower neck is less stress. We can bring the head back, right? But it's a slow process.
Yeah.
It wasn't moving, so now I'm gonna massage and then we'll try to adjust it again.
Okay. You can do what you usually or need to do, and then if it's too much, I'll just say pineapples, and we can.
Pineapple's your
That's our code word.
Yeah, that's the universal
that was
code.
safe word.
I'm gonna do what I usually do, like I said, I call it a baseline. On my first adjustment, I just do a baseline adjustment, seeing if it's been, how many years since your last adjustment?
Two or three.
2 or 3. Did they ever do that hug like that? No?
That's the only thing they did.
They just did that. They
Yeah.
never touched your neck or hips.
No.
I'm so sorry.
Oh, it's. Does anybody ever fart on here?
Happens all the time.
I had a nightmare about it last night.
Oh my. Well,
I don't do that in general, but I'm just saying today would be.
Part of that's the chiropractor's contact. We want to get behind the scenes here. When we're doing the adjustment, if the adjustment should be in a certain angle, that doesn't usually make that happen, but
If it happens, we will cut it out.
No, I would prefer you use it as a highlight.
Take a deep breath in. Look over this shoulder a little bit for me. There we go, real gentle.
Sorry, it's so sore. I'm
Okay.
sorry.
Where's the sore?
Down
In the lower
here.
back. Okay, I'm gonna go real gentle. It's okay. Exhale. It's okay. Other side for me. It's okay. The reason why this is overstressed is because this is stiff. Because this is
Yeah.
stiff. That's what allows this to overwork. So, yeah. Go
It
ahead.
wasn't sore until I put my leg up, and then I was like, oh.
Right. We're opening up the rooms.
Yeah.
We're shining flashlights into the dark corners and going, oh, I forgot there was something over there.
Oh yeah, that's a good one. That's good. I get it.
That wasn't there. Yeah, it was, but you just had it hidden.
Right.
I got a flashlight. All right, deep breath. It's okay. Real gentle. It's okay. Exhale. Okay. It's okay. Face up for me. It's okay.
Sweet and reassuring.
I'm going to massage for a second. I'm not even going to adjust you. I'm just going to feel for a second.
All right. Take your time.
Take your time. So it's like running my hand down a piano. I'm just seeing if all the piano keys, do they work?
Right.
Do the keys go up and down like they should? The main thing is that they all should move, and they should move easily. There shouldn't be the key moving, but it requires a lot of force to get it to move.
Mm-hmm.
The keys should move with an effortlessness, and that's what I'm trying to determine right now. How effortless is this? So this is the upper neck. Remember that atlas axis I just was talking about?
Mm-hmm.
This is where your neck is, right? Feel that little crunch right there?
Yeah, it sucks. What is it? That's my atlas?
Yeah.
F that
Well,
atlas.
it's some tightness, some injury next to it, which allows the lower neck right there. Here it is. You got it buried. I know all the hiding spots. It's like hide and go seek. I know all the best ones. The original tissue in your body was like this. So when you stretch the tissue, it's like there's connections. Does that make sense? And it stretches. When it tears, it heals
Oh.
like that, right? And that's what I'm feeling. I'm running my hand and thumb over
I don't remember an injury, but it's like everyday injuries.
Well, it could have been, like I said,
Roller derby.
roller derby.
Oh yeah, I forgot. Never mind.
You didn't grow up with Dr. Bo. My father is your father, so I can't trust any.
Right. I did a lot of wild stuff. Never mind.
I literally the other day I finally got it from her. She's like, well, in college one time I passed out and fell backwards and hit my head. I'm like, yeah, that sounds like that's about right. I'm like,
She was like, I fell down a flight of stairs.
being upright and then passing out and just falling over from an upright position and hitting your head on a dresser sounds like an injury.
Yeah, true.
Anyway, so I had a little much to drink there, Ed, and I just didn't.
Oh, if we're counting drinking nights, forget it. My neck's probably broken.
We're smoothing it out. You're doing great right there. Feel that? It's starting to soften up.
Yeah.
That's when this area gets tight, the lower neck overworks, head goes forward. Yeah, Ed, you already said that. I know. It's like going to church. Sometimes they say the same things over and over again.
But maybe it'll stick.
Right, exactly. Make it stick. That's right. It's like combing my kid's hair. Hair doesn't untangle itself
Right.
by itself. You have to put work in to untangle it. This is why I have a job. And then once it's untangled, I can teach you to brush your own teeth.
Yeah.
Teach you to brush this yourself, and you shouldn't need constant care from a chiropractor. The goal should be, guiding people to take care of themselves. We're not trying to move every bone. We're just trying to loosen this top guy. Real baby adjustments. Okay. Real gentle. There we go. It's okay. Relax here. Okay. Real gentle. I got you. It's okay. Real gentle. It's okay. All right. It's okay. Real gentle. I got you. Let your chin go up. Now relax your chin. Now relax. I got you. Real gentle.
Oh, there it is. Sorry. My leg went off. It was leaving the room. It's like I'm not.
You okay?
Yeah.
All right. I go for the largest misalignment first.
Oh, really?
The largest misalignment's on your right side here.
Interesting.
The left side is less misaligned. That's why it moved. Why did the right side not move? Because the distance is farther. So I think of it like a baseball field. If you're on the pitcher's mound, it's easy to throw the ball to home plate.
Mm-hmm.
But if you're out there on the warning track,
Yeah.
it's a longer throw, right? So it should be easy. None of the adjustments should ever be difficult because the bone should be in the right position.
Right.
It should be on the pitcher's mound. It shouldn't be out there on the warning track.
Right.
How did you get this far out from where you were supposed to be?
Yeah.
Well, I don't know. I slowly walked my way out here.
That's
I used to be on the
true.
pitcher's mound and I took baby steps every day and now I'm on the warning track and it's a tough throw to home plate. So
Yeah.
I'd rather not He-Man throw it. We're going to try to walk into the infield and we're going to make a throw from second base. And
That was a
we're
good
gonna-
one. Good analogy.
If you see, as a doctor, the word doctor just means teacher. So the whole idea is you're supposed to learn something. And if I say something that isn't making sense, then I'm just wasting air.
Yeah.
Right? So
Agreed.
It's important that we have some way of understanding this. Okay, everybody walks out of here. I've had no overnight stays. Real gentle. Here we go. Let it go. There it is. Yep, I know. I know. It's okay. You okay?
Mm-hmm.
You did great. See, your neck belongs way back here. As odd as that feels.
Well, it feels so odd. Like there's no way.
I know. This is where your neck belongs.
It feels like my throat's falling out
I know,
of my esophagus.
I know. They did this about 1,000 years ago. This is not chiropractors that came up with this. The Chinese figured this out 1,000 years ago as a way to speed up healing by bringing blood into the tissue. It brings nutrients in, allows the waste to be removed, and you speed up, which is really what healing is replacement. Does that make sense? Like fixing a kitchen, you have to bring materials in, but you also get the old stuff out in order to build up the kitchen and remodel it.
Yeah.
So good stuff in, old stuff out is really the word replacement, which we use as the word healing. The proper term to me would be replacement.
Right.
The old stuff has to be excavated, and then that allows the body to build it back up again. So right in your upper neck here, there's a little mark right up there, right up in the hairline. This is the upper neck where it's clogged, the atlas, the axis.
You said there's a little mark already?
There's already a mark, yep.
What? It didn't even hurt.
I know, it's not supposed to.
Oh.
So if you can, even with her chin down, you guys can see, my viewers, her neck likes to fold. Let your head drape back a little bit. See, right, that first fold, let your head look straight forward.
Like
See how
what?
you're fine, you're doing great.
Okay.
I'm doing it for the viewers.
Got it.
Her neck likes to fold right there, and that's where the most pinchings happen. That's why her head's going forward, to alleviate stress here. So it's tight up here. That's what allowed this area to overwork, and now the avoidance. So we're going to loosen up the upper neck, and then in a minute we're going to go face down. We're going to loosen up her upper back. So real quick, like right there, there's already a mark on your neck that your husband will. I've seen your husband; he's really macho, and so I don't want him to beat me up.
What kind of doctor is this? So that's so weird. So you're telling me
There's already a mark.
that it turns
I'm
red
going to take a picture in a second.
in areas specifically where there's issues.
Of clog, where it's clogged.
What?
So it's tight. Think of it as stagnation, right? It's tight and stagnant. That's where all the crud is sitting in there. You understand? It's a bunch of crud in areas of stiffness.
Is it like in the muscle or in the skin or?
Muscle comes up from the joint ultimately, but yes, it's in the muscle now. It's closer to the surface. I'll show you a picture. I'll show you a picture in a second.
Very weird and sciencey.
All right, this is pretty gentle. I'm just there's a mark.
Couple things. That's what the back of my neck looks like.
But do you see the crease? That's what I was trying to
Yes. And I'm literally not wearing anything other than a turtleneck for the rest of my life.
No, you.
So this is where you're overworking. That's where it's overworked. Do you see how there's not much folding? All the bending occurs here. We have to, but it will. We're going to create some creases up there. That's my job. I need your neck bending up here. Remember where the atlas and
It's
axis?
supposed to bend up here.
Yes. Your neck should bend everywhere. There should be folds in the whole neck.
This is the 3 red dots.
It's all frozen up there.
Oh.
That was the adjustment part, right? I have to unlock it. That's my job. And then I'm going to teach you how to keep it moving. That's why I asked you earlier, what was the purpose of the adjustments? What did they tell you? Maintenance and crack bone. Like,
They didn't tell me anything. That's why I didn't know how to answer.
It's okay.
I was like, I don't think they told me anything, actually.
That's typical, but but you said you worked for them, so I thought maybe they would,
He was a real though, and I didn't pay attention to anything. I could not stand him, so.
Okay, that's unfortunate.
I
Okay.
know who you are.
Jeez.
Sorry.
So Ed, I feel like you spent more time rubbing the left side of my back than the right. I'm going to rub the right in a second, but correct. This side's going to get more attention because it's more misaligned.
It doesn't hurt even. I don't know if it's supposed to hurt.
No,
but
no, it's not.
great.
Doing good. You're tough. Women are the top. All my top 10 most BA patients, women are all women. They're all the biggest weenies are all men and. Oh, help you.
But again, it's because I have a negative 0.4 lactic acid level. Whatever you call it. There's none in here.
The trickiest word is always, you'll wonder why I slow down, is always when I say disc. Because you got to be really careful with that one. It happens only one time in a chiropractor's career.
Do you ever do that thing where you, not that I'm interested at all, but you like wrap a towel around somebody's head and decapitate them?
So if I traction someone's spine quickly, you're mainly going to be tractioning what's already loose because it's loose. Right? You're not going to be tractioning the stiff parts because they're stiff.
Right.
So the chance of further stressing and spraining the loose areas is high. It's a balance thing. If an area is doing less than it's supposed to, another area has to be doing extra to account for it. So if you yank somebody upright, and then I just got done telling you it's supposed to be curved, right? The lordosis, right?
Yeah.
The normal alignment of your neck is not ortho, which means straight. It's supposed to be lordotic, meaning arched. Now it will feel good, perhaps, because what has feeling, right? There's only two structures that have feeling.
Ooh, I know this one.
Joint and the nerve, right?
Yeah.
Right? So in both of those, you're taking weight off those by doing that maneuver. So Ed, I liked it. It felt great. I understand.
Right.
That will be a normal reaction to that because you can't feel the disc. You can't feel the cartilage. But think of the cartilage like a piece of fabric, right? If you have a piece of fabric that has a tear in it, should we hold the fabric taut and pull on it real hard?
Right.
Won't that further tear the...
That's a good analogy.
You know, it's already torn. So the disc has bulges, herniations. These are injuries to the disc. So how do we know we're not further ripping open a wound in the disc that you can't feel?
This is wonderful for me, but it sounds like a lot of work for you.
No, I do.
I was like, you're handling this part very well.
She's tough. I'm learning. I'm learning her.
Wait, is it supposed to not be?
No, everyone's different, so.
You have me all trepid to being like you're all gonna be all weak back here, but she's like tough back here, man. Careful, I'm a little skinny. I'm just a little baby white belt. I can't. And then she does like a jumping back spin kick. I'm like, yeah, right. A white belt my butt. Who trained you? Mm-hmm.
I'm a spy.
Okay, all right. Exactly. I'm trusting this. Getting all that.
There's something weird there.
Yep, these are the anchor points of your neck.
Oh.
Yep.
Spoke too soon.
Push all those down. And the mark, you'll almost tell me where the mark's going to come out, right? You understand, right here?
Yeah.
This is where the mark's going to be. Well, the areas that aren't as sore, there won't be as much of that mark. And then usually by visit 5, 6, 7, there aren't any marks even if I tried.
Interesting.
The marks only come out when there's whatever you want to describe that as, soreness, right?
Yeah.
Tenderness. As we absolve that and as we change the posture so this doesn't build up so quickly, otherwise I become a glorified bottle of Advil. Ed, it felt better for a few days and then it's back again.
Right.
Because the head being forward is what creates this.
Oh.
There are areas here that I'm asking to move that haven't been moving, and as they become more acclimated to moving, they're going to talk to you. They're going to say, hey, what'd you do yesterday?
Yeah.
What was that for an hour when you rubbed your back? Well, there we go. Mm-hmm.
I feel like soreness and pain is fine if it serves a purpose.
Mm-hmm. Yeah, we can.
Like I can deal, you know what I mean?
Sure.
But if it hurts for no reason, like I stubbed my toe on a table, I just want to burn the house down.
Just gonna stand there.
The good song.
Yeah, like right there. That's where the mark of Dr. Ed.
Is that the anchor point?
Anchor point. You got it. It's just lactic acid.
Right.
You're saying it's not a ghost in your back. It's just some acidity trapped there because the muscles are working harder than they're supposed to because your head's forward, because the posture's not correct.
Right.
It's just lactic acid, and that's why it burns. Why it's sore when I touch it. You go, Ed, yeah, it's a little sore and catchy there. You know.
Yeah.
It's not supposed to be sore. The posture is what determined it.
Interesting. So when I was watching your videos during this part, it looked
Like I'm a little crazy.
like you were rubbing their skin raw and exposing their epidermis and blood. But this, as you're doing it, it feels like good on my end. Like I'm like, this is nice. And so it's very interesting to me. And maybe you're going easy, and I should just shut up. But
You see, when you watch the video of your back, you're like, it was coming out as I was saying how easy it was.
that's so crazy to me, though.
It's not supposed to be, tearing people's skin off of it.
But that's what it looks like. And when you watch it, you're like, I'm like, I doubt he's going to do that to me, though, because I'm not a bodybuilder, so I don't have to worry about that.
Everybody walks out here, but there's a mark right on this left side. This is kind of above and below the bra strap here. This is where there's congestion. This is like I said, this is easy to fix. Have people leave here and go, Ed, my urine smelled different. You're going to have waste.
Ed, this was not on the paperwork.
Yeah, this is it's all coming out in here. Doing great.
So, stupid question. Is it like a cheat sheet? Not that you're cheating, but like, does this like a map point to all the areas that are messed up because they turn extra red, or am I just thinking that?
So where the marks come out is where the most tension is trapped, correct? And then there's also something called the Merrick chart. So not only do these nerves come out and go to your hands or down your leg, they also go to your organs. So there'll be a connection between, I have high blood pressure and these areas up here are inflamed. This is your stomach.
What?
This is your pancreas. This is your transverse colon. And so this gets into usually a future visit where I then explain to you that your spinal health is your health, that the function of your organs, see, the wires that leave your brain go down your spinal cord and they exit your spine. They control not only your muscles, but they also control your organs. If you have numbness in your hand or numbness down your leg, do you see how there's also numbness to an organ? Right? But we don't really feel our organs the same way we feel our skin or our muscles, so we don't notice it. But you'll have constipation or you'll have high blood pressure. We call them the sympathetic nerves. The nerves that speed up your heart, for instance, come out of the left side of your upper back. So thoracic 1 through 4 on the left side is where the cardiopulmonary nerve, the nerve that is your sympathetic nerve to your heart.
Wait, you're saying it speeds up your heart?
So this is the gas pedal of your heart right here. Yes, ma'am. Yeah. So the nerve, I'll show you in a bigger diagram later in a second, but yes, the anatomy, this is not my chiropractic opinion, this is the anatomy. The nerve that speeds up your heart comes out of here.
My heart is so wild.
And so, yes, people come into my office all the time with organ symptoms, and as we clean their spine, all that dissipates and calms down. The world didn't connect the dots, and I'm just hearing that your chiropractor didn't either.
This is blowing my mind.
The chiropractor didn't tell you that, the health of your spine is your health, that not having tenderness along your spinal column, like the brain writes the teleprompter that your organs are reading. The organs don't have any self-intelligence. They read the information that they're given by the brain. So what happens, like if I'm writing you a text and I delete every other word, it's not intelligible anymore, right? You can't understand what I'm trying to say, and that's what inflammation does to the signals from your brain to your body.
Whoa, that's a good one. I don't know if it's called an analogy or a metaphor, but that was a good one.
So if a tiger's chasing you, do you need your stomach to be releasing acid and digesting that hamburger? No, right? So inflammation of your upper back shuts down your stomach, right? The person goes to the hospital, how do you feel? I have indigestion, I have gastric acid reflux, and okay, so your stomach's not digesting food and moving things on throughout the system, right? So as I cleaned her upper back and as I adjust her upper back, she leaves my office and goes, Ed, after I get adjusted, I digest food perfectly.
Wow.
I don't have gastric paresis. Because why is the stomach, they don't give an explanation. Why did all of a sudden a healthy young woman develop, her stomach stopped working?
Because she was getting chased by a tiger?
Right. Or what stress does, right? Stress shuts down the parasympathetic.
Oh.
So there's twofold. Depression shuts down the calming nerve. So the parasympathetic nerve causes your stomach to digest food, okay? If you're stressed, worried, only getting 4 hours of sleep, that causes indigestion because now the system that activates your stomach to function isn't working, right? So there's a duality. It's not all your back. Dr. Ed, I think there's more than one. You're right. It's more complicated than it. I'm putting it in a very basic form here. But
you know what I love?
So I'm just getting to know you. And I always, when I get to know people, like to listen to them and absorb them. And I love how you have conversations with yourself based on what question you already know I'm going to ask.
Right.
Like I don't even need to ask it because you just do it for me. And it's so funny. And
But yeah, we'll take a picture of your back in a second. I'll let her see I'm sure it did not, like I said, there's marks all over your back, but your perception is that was it.
yeah.
Right. It felt relaxing and soothing. It's just drawing blood to the surface. Like we could almost cook something back here. It's toasty.
Really?
There's a lot of warmth coming off your back.
That's so interesting.
Nutrients,
Is
blood.
that why they do cupping?
Same purpose, extraction. You're drawing out the old stuff, right? Because we can't put in new cabinets until we get out the old stuff.
So interesting.
That's the process of healing. Healing is replacement. Again, we use the word healing, but it's not the right word. It's replacement. Your skin doesn't heal, it replaces. New skin's made, the old stuff falls off.
Right.
If you damage your skin faster than it can replace, Ed, I'm not getting better, I'm not healing. Well, right, you're cutting your skin faster than it can.
Right.
New stuff can be made. So that happens internally with joints and muscles. If only a part of your body is doing all the work, you'll tear it faster than it can heal, right? Faster than it can replace. And so now it's chronic. I have chronic lower back pain. I have chronic because you get chronically punched in the face every morning, your face is chronically swollen.
Yeah.
My answer is don't get punched in the face every morning, your face won't be swollen.
Yeah.
What? Yeah. That's all that. We got to get it out of there. That's cleaning. We got to clean all that out. I know. There's your tattoos.
Oh my God. That's wild. That's
where all that pain was.
Yeah.
Yeah. That's the left side. It's higher. I didn't take a 3D shot of this, but this is elevated over here. We'll get there. You're doing great.
I didn't even feel that.
I know. I've told you I'm sneaky.
That's crazy.
Now it's going to be, like I said, tomorrow morning. If you want an Epsom salt bath, would be a good home treatment. The Epsom salt causes it to come right out the skin, so you can draw this inflammation right out the tissue.
So that's part of
bath.
your recommended.
Please.
Is a bath.
Evening time.
Candles.
Perfect.
Okay.
Yes.
Just checking. That's my husband. He's like, "Are you alive? Did he break you
I know.
in half? What's going on?"
Breathe. There you go. There we go. It's gonna feel a little weird. I know. There we go. There we go. A little bit. There we go. Keep breathing a little bit. I know. Good. Okay. Put it this way. Good. Okay. This is the joint that we were trying to adjust on your side, and so over time, as we progress, we're going to keep loosening this joint up so that it'll move on that side. But I don't want to go any harder because this is where it'll probably move.
Okay.
And this is where MRIs are helpful. You know, you're 36. If we take an MRI of you, I expect to see 36-year-old, does that make sense, discs in here. There we go.
Would it be helpful if I did that for you or no?
Well,
If it's something that you're
the first
like-
thing I want to do is get through a handful of visits with you.
Okay.
See how things change.
Got it.
Like many doctors don't even want to work on you without a picture. Right? Where's your picture? Where's your MRI?
Right.
I go, guys, the MRI is supposed to validate what you already know to be true.
Right.
From working on you, because this is tight, this must be older, because this is young. So, does that make sense? It's a balance, a yin and yang. If one area is young, another area must have compensated and aged. So, based on the amount of tightness that you have up here, it's probable that this is older. That's why when I put you on your side and I rotated you, and you went, careful, Ed, careful, it's hurting down there. That shouldn't happen, first of all. I should be able to rotate you and you go, Ed, is that all you got?
Oh no! So we discovered something in my hallways that I didn't. Oh,
We're shining flashlights.
terrible.
What do you got over there?
So my real problem could be something.
But you're in avoidance, so it's tough.
Well, that's my favorite coping mechanism in general.
And then I get blamed for stuff. Do you see how I get, Ed, you're hurt, you hurt me.
Yeah.
No, I made you look at the stuff that you ran away from.
Yeah.
You okay with this? You okay?
Me?
Okay, is okay? I'm
Oh,
going to
I love it.
Okay, I'll go a little deeper. I'm just getting you.
Oh wait, I shouldn't have said I loved it.
I know,
I mean,
yeah.
it was fine.
There we go. Oh, there we go. All right. Good. Okay. All right. Well, I'm going to go real gentle.
Is happening?
It's okay. I'm gonna go real gentle.
Oh
It's okay.
no, are you doing the
I'm gonna go
thing?
real gentle. I got
Just
you.
part of it. I'm not sure.
I'm gonna go real gentle. I got
I might
you.
be too heavy. Okay.
You're fine. I'm gonna go real gentle. Here we go. We're stretching. You okay?
Mm-hmm.
All right. Breathe, breathe. I'm not gonna overwhelm you.
I'm nervous. Okay.
It's okay. Breathe. There we go. Good. 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 Okay. All right. You're okay. Not gonna go crazy.
I believe you. I'm not. I trust you.
Not going crazy.
I just said I trusted you. Oh my God. This is the Cirque du Soleil thing. How are you? I weigh like 200 pounds.
Breathe. I got you. Breathe. Breathe.
Oh! It was the headrest. I'm sorry.
You're good.
I shit my pants. I'm so sorry. All right, I can pull it together. Do you need to do something?
I'm good.
Are you doing? Her the headrest dropped,
Okay.
so that.
So my light flashed before my eyes. It's fine. I'm good now. I'm ready.
I don't need to go any harder than that. That's
Are you sure? I think she wants it.
Oh, I'm not.
Breathe. I got you.
Just a little bit.
Good. Okay. It's good.
You are now a circus performer.
I did it. Nothing. I don't know if is it too tight.
It's okay. We're not going to any harder than that. We don't need to. I can.
That's a lot of weight for you to lift.
Get out of here. You're
You're
fine.
really strong. I saw a freaking ballerina in here or something. She was like a freaking in shape ballerina. I was like, I know he's not gonna do that to me.
Mind if I check your ear?
No, I don't mind. I can clean them.
Get out of here. You're fine. Okay. You're real gentle.
You said in your adjustment?
So there can be adhesions behind the ear. The drain lines that go down your neck go right across this area. So if there's a lot of glue back here, I find that it opens up the ear, helps the sinuses, helps things drain better.
Okay.
We'll go gentle.
You said glue?
I think of it as adhesions. I mean, glue is the more lay term, but
Okay.
I'll get you.
Do I have to do anything?
You're fine. 1 second. I got you. Real gentle. Turn your head. Tilt your head to the right. Tilt right.
I don't know what's like right.
So I got you. You're going to tilt. Like
Okay.
that, but 1 second. Like bring your right ear to your shoulder. Tilt. Okay, it's okay. Not going to go any harder than that. There we go. Tilt your head to the right.
Was that a crack?
Uh-huh.
No. It was it? What crack?
I think of it like, I don't know. You ever have like a piece of paper or a book and you open up the book and the pages seem to like why the heck am I having to like,
Yeah, but that's a different kind of bug.
well, I don't mean like that.
Okay, sorry.
Daggone it.
Okay, sorry. But yes, I know what you I know what you mean.
What kind of book are you reading there, Ed? You call it a book? All right.
Sorry.
My Bible.
Okay,
I've
that's
had
fine.
pages in my Bible where they're
Yes.
real gentle. Tilt your head left. There you go. Okay, I'm not good. That's it. I think the tops are where most of it is. Tilt your head to the left.
Ah! What? That's so weird.
Good sport.
It sounds like squiggles.
There we go.
God, I'm scared.
It's okay.
I'm gonna hate it. Oh, I'm gonna hate
I
it.
got you. It's okay. I got you. Here we go. I got you. Uh-huh. 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 What? Uh-huh. Come on. Let me relax your foot. Relax. You just not asking the joint to do anything outside of what it was designed to do.
Okay,
Okay.
so you're not gonna
I'm not,
dis...
I'm not
What's it called?
dislocating joints.
Yeah, yeah.
Okay, I got you.
Oh my God. That is a bone I didn't know existed.
Okay. Like I said, your biggest security is your hubby. Uh-huh, and I am not making that man upset at me.
Oh.
There we go. I got you. Relax your ankle, I got you. I got you, relax your ankle. Wow, just a lot of...
Oh! I'm so sorry.
Woo!
I'm so sorry. That was shocking. I was like,
You got-
I'm gonna be off that.
This roller derby, I need more. What did you do to these ankles? They are frozen.
I believe it. I walk on the sides of my feet like a weird.
The joints shouldn't have that much glue between them. You got the joints all sandwiched together. I asked them to just open up a little bit, and they're like...
Well, no one's ever asked them to open before, so maybe they're a little shy.
Good sport. You did great.
Wow, my ankles feel cool. Everything feels cool. I feel like you're undervaluing this first appointment. Like, I would pay big money for this experience today. I learned things. I got a massage. I got a gauche wash. It was really great for me. Okay.
Is this in the right spot?
Yes.
Wow.
Yes. It's right there in the upper neck. I want it in the upper.
Okay, so not in the.
Not in the lower, not where that crease is. I want to avoid
that's
the. Your favorite little.
My favorite little face.
Is that my neck?
I can't believe it. I've never seen myself from the back.
Yes.
Very depressing.
Didn't transpose like somebody else's neck real quick.
Yeah, that'd be. I'd appreciate it. Thank you so much.
But yeah, it's behind us. It's sneaky. We don't see our back.
Yeah.
That's why we don't have it's hard to connect with our back. It's like, it's always, where is it?
So the bone being out of place is causing my skin to just form this weird thing?
It's where you're folding. So where the vertebrae bend are where the skin bends. It's where the skin is creasing. And the skin has creased there so many years that they're like, it's like folds on this face, right? Like my eyebrows or my forehead, right? It's like that's where the skin folds. And you want it to be as even as possible so that your spine ages evenly. Okay.
Is it normal for my low back to hurt in this position?
No.
Oh.
So go ahead and bend your knees. Go ahead and bend your knees.
Yeah, that'd be nice.
I know.
Okay.
Remember how when you bend your knees, the hole in the lower back gets bigger. And that's why we have a problem down there.
That's so crazy. Now that you pointed it out,
But you've been avoiding it. That's why Ed, I sit a lot. Ed, I'm used to having my knees bent. And I noticed it right when I had you on your side on the side posture. Right?
Really?
When I had you rotate, and it's common when people have you were trying to do all your rotation with L5. That's why it hurt, because you have an area that's overstressed. I had you on your side and rotate. If everything's rotating evenly, you won't feel anything. But if you just kept chewing on the one tooth that's more sensitive, because I'm revving the engine, right? It idled okay, but once you revved it a little bit and put 2,000, 3,000 RPMs, then it started to misfire.
right.
But I should be able to go to redline to 6,000, 7,000 RPMs, and it shouldn't, Ed, if you idle, it runs fine. That's what you want from life? Just idle? You just idle.
Yeah.
I want you to be able to, see, if I can get your car running at 7,000 RPMs, you can go to 3,000 all day long.
Yeah.
Because it's running perfectly at a high, that's what that stress test is. The table is, I'm asking everything. I'm asking for your spine to function at redline. And Ed, you're being a little aggressive here, Ed. You're being a little, careful, right? Because I'm asking for everything. And that's where I'm trying to say I'm going to ruin you for all massages, because now most people are going to ask for 3,000, expecting 3,000 to be difficult.
Yeah.
I'm going, no, I'm going way past that.
Right.
And now 3,000 is going to be, what do you get?
Yeah.
And so there's a lower back aging that's going on here, and I know that wasn't even your chief complaint, but it's a domino. Remember how when you had your hand on my middle back and I bent forward, remember how my middle back got tight? So the avoidance that your neck has gone through is causing middle back tightness, and that will eventually cause lower back overstressing. But because we're forward, this is also why I don't want to go fast with this, because as I bring you back, and my lower back is hurting more as we've adjusted me, right? Because I'm holding you. For instance, after you do these stretches, if I took a picture of you before you stretched, and then after you stretched, you're more upright, which then your lower back isn't being avoided, so therefore you feel the monsters that are present in there. Your shoulders are forward. This is why having your arms up is difficult.
Yeah.
Look at me. Your arm wants to be here.
Yeah.
You're saying we got to get your shoulder to be able to retract.
Further back than this?
Right. When I look at you from the side, your ear is still, like your bicep should be able to become behind. Right. Right now you're about here.
Oh yeah, that's as far as it goes.
I understand. It's okay. You're not going to see a permanent change in posture until you're approaching 20 minutes. It takes 20 minutes to fatigue the ligaments on the front side of your body.
Oh.
So they call it ligamentous creep, is the lengthening of the rubber bands in the front. It just takes time to get there.
Okay.
All right, so try one more inch. Roll down a little bit. There we go. Right, so the bra strap's going to be the difficult area because that's where it's all popped up, right? So we want to try to get this around the bra strap area in addressing that symptom you have in your middle back.
I'm an athlete. Thank you.
What I'm saying is after you've done that for a while, when you get up, it's going to be a little bit of like, whoa, because we overcorrected back.
Yeah.
So that now your body's going to want to be more in the middle.
So good.
And that tension you feel is just postural. It's all guarding and posture. And as we make this easy, then being neutral is just going to be a cakewalk.
Yeah.
And as we deal with all that inflammation in your back, clean that all up.
Yeah.
You okay? You did great?
I feel so good. Thank you. I really do. When at sleeping at night, is there a specific pillow situation you recommend?
That's the general pillow that we'll talk about in future visits. But yes,
Okay.
that I want. See, what you said, I think you said you don't like to sleep on your back. Is that what you said earlier?
No.
Your
I mean,
side.
sometimes I do, but I have a whole pregnancy pillow that has 2 long pant legs that I flip over.
But you like to be on your side primarily?
Yeah.
So part of that is because of all the stuff I showed you on that picture of your back. Your body gets away from that by being on your side. When you're on your back, you're pressuring all that inflammation that's on your back. So I don't blame you for getting away from it. As your back gets cleaner on the table, meaning no marks come out, and you can push as hard as you want, it's not sore. Does that make sense? You're not going to feel the need to get away from it. You'll lay on your back and go, oh.
So it doesn't matter, like, I guess I'm worried that I'm ruining things by sleeping like this in a cocoon.
You are.
Okay.
Yeah.
Cool.
It means that position holds certain parts stiff, and then when you get up and go live life, you're not running with all the cylinders. Some parts of your back are going to age quickly. That's what, again, the MRI would kind of give us a clue into, and maybe we'll talk about that in a little bit, about ordering one of those, but that would show you, look, at Tiffany, at 36, part of your spine is older, and we don't want that to continue aging. Any thumbnail ideas? Maybe you get
Oh, I think we have.
got enough? Sure.
There you are, I'm totally posed.
At the end, she's always like, I didn't get a thumbnail.
I'm pretty sure there's gotta be, I mean, just,
Tiffany Jenkins and
I mean, that would be funny for Instagram.